John, good to see you.
Good to see you, Andy.
Talk to me about this event we've got coming up.
Okay, so we've got an event called Articulate coming up. It's something that IBSA and IBSA UK have run over the last couple of years, and we're really proud to bring it up to Manchester in collaboration with Physiquip this time. We've got some great speakers. We've got Richie Barber, who's ex-Paralympic swimmer himself and the ex-clinical lead. And he's talking about the para-athlete, para-shoulders and treatment options. And then we've got Dr. Jim Moxon, Man United first team men's doctor, Jim, who he's going to be talking about football injuries and treatment strategies. And then we've got Dr. Raj Singh, who is GB Boxing, England, Wales and Pakistani Cricket Board. And he's going to be talking about the use of diagnostic ultrasound and hyaluronic acid as treatment options. So we're going to be doing it at MIHP, which is Manchester Health and Institute and Performance, on May the 21st, Wednesday, May the 21st, between 6 and 9. There'll be food available between 6 and 6:45, and then the speakers will start at 7. So yeah, we're hoping to get anywhere between 40 and 50 people coming. So you need to book early if you want to get in.
No, it sounds really good, and we've run quite a lot of events at MIHP previously. And like for us, diagnostic ultrasound and imaging it's changed our business really. It's absolutely exploded. I know you've worked clinically as a physio previously. So where do you see the trend going of the injectable?
Yeah, I think putting my physio hat on, over the last 10 years, it's started to grow more and more. People want to be able to see their injury on a screen and they want quicker access, and ultrasound provides that. You know, having worked for the Football Association of Wales on the women's team, we were very lucky that we had Dr. Jonathan Houghton there, who had his ultrasound machine there, and he could quickly help out if we were just about to go away and we needed a quick diagnosis. You see a lot more clinicians now who are interested in doing their PG cert and developing themselves from landmark injectors, because again the general public, the way it seems to be going is that they're more interested in having options that aren't surgical options, but also they want people who are well trained, who are delivering a good service and also giving them a clear diagnosis without having to wait for reports because it's so instant.
Yeah. I mean, I've certainly seen there's a much bigger increase of this stuff being used and wanting to be being used. In terms of from an ultrasound perspective, we know that the training pathway can be quite long and it's still a little bit of a grey area as to who's doing what. So from the injectable side, like what's the regulatory piece on that, and like how easy is it for people to start getting involved in this stuff?
Yeah, so with the hyaluronic acid side of things, it's considered a medical device, and so it doesn't need a prescription, and so long as you're trained in ultrasound guided injection, especially for our product, Synovial, we particularly want people to be trained in ultrasound because it's a high and low molecular weight, and we want to know that it's going into the joint. And to be quite honest with you, that's what patients want to know. They want to know that it's gone in the right place. And what's great about ultrasound is that as the needle goes in, the clinician can take a picture, it can be put into the patient's notes, and they can also be shown it on screen as well. So yeah, it's more accessible because it is a medical device and it doesn't require prescription, unlike PRP or steroid.
And for again, sport, like you mentioned, Jim and Richie are speaking and they've come from that sporting background, and everyone assumes they get all the VIP stuff, they get all of these different things. Even Man U, you know, with some of the things that, across the board from that clinical application piece for private practice, we're seeing it growing. But how applicable is this for private practice?
I think it really suits and fits it very well, especially because people don't feel like they have the time anymore. The pressures of being in work really drive people to get a clear diagnosis and then also have the treatment options available. And having them being available there and then in that moment are a big part of why I think, and probably why you're seeing treatments and the uptake of ultrasound growing.
And so, in terms of for this particular event, like who's the ideal person that should be considering coming to this?
I think it's open to everyone really, because we work with a lot of different people, from MSK podiatrists right through to people like Jim and Harjinder, who are working at Olympic level or a Premiership level, who delivering world-class treatment options. But equally, we also work with people who are interested in going from being landmark injectors to ultrasound-guided injectors, and that could be anyone from an NHS physio, NHS doctor, who has got an interest in this and wants to develop themselves. So I think from the people who should be coming along to it, it should be anyone who's got an interest in sport, who's got an interest in healthcare, private healthcare, NHS care, basically anyone who's got an interest in developing themselves.
Which is you would hope would be most people that are looking into this side. And so, okay, from an NHS perspective, like how commonplace are these treatments within the NHS?
They're not at the moment, unfortunately, because NICE guidelines have quite clearly say that they're not an option. But what we should remember is that they are guidelines, and there are some NHS clinics that do provide hyaluronic acids, and there seems to be a growing number of them as well. But as a standard treatment option, it's still not there yet.
And so, from how widely is this? This is really interesting for me. Just I'm enjoying finding out about all this stuff. Like what percentage or how big is the market within the private space currently?
It's interesting because it seems to be growing because there are diverse clinicians, as in you would traditionally think of someone delivering ultrasound guided injections as a doctor or a physio, and now we're seeing the development of the MSK podiatrists. I work with 3 great podiatrists over in Belfast who have started to drive their professional standards up, and they're looking to help people to drive that as well. And I think because it comes from the general public to actually, there's obviously a need, because that's why things are growing. So what is the percentage? It's hard to put a finger on it, but having worked across the UK now and started to look at Ireland, there is a part of the market that is definitely growing, and we're seeing the growth in it.
And so, from a clinic, if you're working in a clinic or you own a clinic, then what are the considerations that you need to have if you were looking to bring in, whether it's injectables, ultrasound, or like all of this?
Well, there's obviously the licensing that you need, so you'll be under the CQC, who will want to make sure that you're delivering it at the right standards. And then you'll also have your own governing body that will also need you to have regular updates to make sure that you're basically up to date, and that you are following the latest guidelines in it. How accessible is it? It's really accessible, because the courses that are available now are an exceptionally high standard, as you well know. And the products that are available on the market, again, they're at a very high standard, and they're accessible.
I think you're absolutely right with that now, as when we're speaking to people about ultrasound technology or so on, is that they do assume it's going to be completely out of reach. And albeit we know there is a big learning pathway as well, which is a cost, both in terms of time and financial. Everyone seems to be saying, look, this is the future of where it's going. This is going to be gold standard. This is the pinnacle of what people can do within those professions. So, like, what is your advice for people that are sort of on the fence about this?
There are a lot of fantastic courses out there that are very easily accessed, and also the people who run them, they're very easy. You can talk to any of them, and they will give you advice. They can talk to people like yourself, because you've got a lot of people you've got a great network of clinicians who you provide ultrasound machines for. And yourself, you speak to Chris Myers or any of those guys, they will speak to anybody, and they will give you advice on what they think would be the best course for you. And there's not just one course anymore, and that's the great thing. And there's also different levels that you can access at different times in your career, depending on what you'd like to do. You don't have to go for the PG cert. You don't have to do the diagnosis. You can do an ultrasound course that will just allow you to inject and make sure you're in the right place. So my advice would be reach out, speak to the people who run these courses, because they're all fantastic clinicians. They've got a huge amount of experience and they're all willing to talk to you as well.
Yeah. No, I think it is a really exciting area, and I've really enjoyed working with you, Kirsty, and the other guys at IBSA on this. And I think from our side, building the academy out, education is the absolute future, and being able to support clinicians and thus the healthcare community and patients. Is there anything else that you think the clinical world who may be watching this should be aware of?
I think for IBSA UK, it's that our educational arm is very important to us, and this is why we're running Articulate. And if anyone's got any interest or they want to reach out to us, then please do, and they can contact us on my email, which will be available.
It'll be down. Yeah, we'll put it in the bio for this. But John, thank you for coming. We're at the Northern Tennis Club. Beautiful day.
It is. It's stunning.
It's stunning. So let's hope the weather's not quite as good at this for the event that we've got coming up. But no, thank you for sharing that, and we'll look forward to doing the event with you.
Thank you, Andy.
Cheers.
Bye.